You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Welcome, Dr. Brown.
Good morning, Polly.
Thanks for coming back on the podcast.
Happy to come.
So I just did a podcast with another rescue, a pug rescue in Northern California, and they are in the process of saving a pug that has a liver shunt. It's a year-old pug, fawn, and it was a surrender, and the rescue did not know about it, but the dog started having diarrhea and other symptoms, and it turns out that it needs a $12,000 surgery. So I wanted to find out, I'd never heard of it. What is a liver shunt?
So the shunt means that the blood supply that normally goes from the GI tract through the liver, and then the liver does all its things to the nutrients that through the blood, and then it goes back out into circulation, that blood supply shunts or doesn't go through the liver properly.
Okay. So
does that make sense?
Yeah.
So it's about, the shunting is a big blood vessel that bypasses the liver when it's supposed to go in there.
So then does the dog not get any nutrients?
Correct. And the liver then doesn't help digest all the nutrients and stuff, but it still has things going on in the liver, and the liver therefore is not well, and that's where most of the symptoms come from. So, and there's, to get really technical, there's two kinds of shunts. There's the one that I think your pug rescue is having to deal with. It's costing so much because there is a surgical fix. So what happens is instead of multiple blood vessels, they can go in and close down this one big ginormous vessel that bypasses where it's supposed to go. So it's a big deal surgery. And then there's other ones that are intrahepatic. So those shunts are not as easy to get to surgically. And then, so they're not a surgical fix.
Okay.
It's a big deal.
And so obviously it's a high risk surgery, and there's probably only so many certain surgeons that actually do it, correct?
Right. Like a specialist would do that. Your GP would not do that.
Okay. And so what do? They take the vein and they have to insert it back into the liver?
No, there's this one big ginormous blood vessel that's bypassing the place it's supposed to go.
Uh-huh.
And so they close it. They clamp it down. They tie it off.
Okay.
I mean, once again, I'm a little bit over my head on the surgery because I would never, ever have learned that or do that. But it's because it's
so technical.
It's very technical, and there's pressures. You have to monitor the pressures in the blood vessels, and
is it genetic?
It's a tricky one. A lot of them are. Yes, the answer to that question is yes, it's genetic. And so normally we worry about that. We see it's called portosystemic shunts. Okay, for liver shunts, the thing people need to be most aware of is one, they're hard to diagnose. Two, there are other things that your dog could have that might not be a liver shunt, but not a significant liver shunt that needs surgery, but still could be a congenital problem. So big things to start that make me want to start looking for things like that. And once again, they're not very common, but would be a poor doer, a young animal that's a poor doer. This isn't always young animals, but typically we start thinking about it because it is congenital. They're born with these things. Two, they're poor doers, meaning they're skinny, they haven't gained weight, they maybe have chronic intermittent diarrhea. And then when I get the most suspicious, it's usually small breed dogs, and we're doing pre-anesthetic blood work for getting them spayed or neutered, and they have an elevated liver number called ALT.
Okay.
Then then that makes me wonder why a small dog that's not sick, a young dog, would have elevated liver numbers from the get-go. So then we do another easy test for general practitioners called a bile acids test, and that's done on a fast. So that the point of that is that if their liver's not processing their nutrients well after they eat, the bile acid test will be abnormal for the second blood draw. It's a 2 blood draw test. So then you get really suspicious, and especially if they have all these other symptoms. If they don't have all these other symptoms, maybe it's not a big deal, but chronic diarrhea, vomiters, not gaining weight, lethargy, and if they start to develop some central nervous system signs like head pressing or worst case scenario seizures. So we're talking pretty sick dogs that have potential for having a hepatic liver shunt that needs, or portosystemic shunt that potentially might need surgery. And then you have to start going through some pretty advanced diagnostics to get to that diagnosis before you even get to the part about surgery.
Okay.
Like the worst case scenario when you get really worried about them is they have what's called hepatic encephalopathy. So they have neurologic side effects.
Okay.
Some seizures, sometimes after they eat, they appear to be blind. That's what I learned, because when they get all these nutrients that they can't do anything with them, then it raises the ammonia level in their blood, and the liver's supposed to help metabolize that, and it can't. So then they have these secondary neurologic side effects from the elevated ammonia in their bloodstream.
Okay.
So pretty complicated issue, not super common, and unfortunately genetic. So if the pug rescue is seeing a bunch, it's probably from some breeding that shouldn't be breeding the combo that they're doing.
Yeah. Okay.
What was the little pug that has the $11,000 fixed symptoms? Do you know?
I think it was diarrhea, and then in the podcast he was talking about how there's some type of liquid the dog can take that's supposed to help.
Yeah.
And it
there's
wasn't
definitely
helping.
some medical management. Yeah, some dogs you try and medically manage with medications, and some do well and some don't do well.
Okay.
Lactulose is one of the drugs that they take. It's a liquid that helps to try and alleviate the hepatic encephalopathy. It's also stool softener, but it's supposed to help with that. So potentially that didn't help his little pug.
Yeah. And they don't grow. It's not like a heart murmur where you can outgrow it.
No. It's got to, you either medically manage it, and some dogs can be medically managed for a long, long time. Other times they're surgical. The other part about that is they're super hard to diagnose.
Yeah, I was going to ask, how would you know if you get a puppy?
Yeah. They're super hard to diagnose. Probably ultimately a CT scan would be the way to go. Even an abdominal ultrasound would be difficult to know for sure if that's the problem. So a CT scan and potentially a liver biopsy, but it's a tough.
Yeah. So,
and sometimes, because the blood supply is not going through the liver appropriately, their livers are usually kind of small. So radiographs are tough. I mean, lots of things can cause small livers. So,
and once let's say it's successful, then the dog will have a happy, healthy life, correct?
Yeah. I mean, probably if the surgery works, yes. if that's not 100%, and so that's the thing, is it going to be 100% successful or 80% successful? There's still a chance they'll have to be on a special diet and some medications for the rest of their life.
Okay. Which, I mean, that's easy,
Yeah, it can be. Yeah, I mean, it can also be labor intensive and cost prohibitive depending on,
what the outcome is.
Right. $11,000. I mean, that's a good effort. That's a lot of money for a not 100% guarantee everything's going to be perfect after surgery.
Right. Well, we wish the dog the best and the rescue.
Absolutely. It sounds like he has a great owner or the rescue foster is a really dedicated person. So hopefully that little guy will get the best care ever.
Yes. Well, thanks for being on the podcast, and we look forward to having you back.
Thanks.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.